Our nation is in the midst of a mental health crisis, one which is affecting every demographic. 1 in 5 Americans are experiencing some form of mental illness, according to the National Institute of Mental Health. How are we responding? Come with me as I go behind the scenes at the Associated's Jewish Community Services. We begin our day at a meeting for Jewish Community Services therapists who are about to discuss some of their weekly challenges and collaborate on the best ways they can help.
As you all know, I've asked Beth from the Associated to join us for the end of this meeting. So she's here just to kind of observe and hear some of our cases. So Beth, welcome to the therapy team.
Thank you. Thank you for having me.
I'm working through the initial assessments with the financial client that we are working on. They are behind their mortgage payments, and they also spend about $10,000 in credit card debt. So they really need help understanding their financial behaviors and their relationship with money. So I'm looking forward to exploring that with them, but I'm also going to connect them with economic advancement.
I do have one client that does have some more serious needs that I'm thinking of referring them to the Family Navigator program.
I actually referred a family to them earlier this year. The family was suffering with a loss of the father, some substance abuse issues as well. The child was acting out at school. Mom was in a severe depression over grief and couldn't even go out grocery shopping.
The Family Navigator program begins with a free, in-depth assessment. JCS personally talks with individuals to understand their challenges, then connects them to services and resources, coordinates care, and provides support every step of the way.
Beth, let's take a walk to meet our intake team so you can see how people get access to us. Yes. Great.
When someone reaches out to JCS by phone or in person, the first person they talk to is a member of the intake team.
The demand increased significantly once the pandemic hit. We never saw a decrease. We saw a significant increase even in just the calls coming into the agency. That increase has not slowed down at all.
When someone comes, either shows up at your door or calls, how does that assessment work?
The staff that are going to respond to you are mental health clinicians. They have a lot of training and experience in working with individuals and helping them be able to express what it is that they're experiencing, and then trying to get them connected with the appropriate services, whether it be just therapy, whether it also be through our clinic for medication management. It is not uncommon that they may call us for financial assistance, but during that intake process, we identify with them that they are struggling with depression or anxiety. And at the point somebody either calls us or walks in, they are in a crisis, because that first step of asking is not an easy one. So it's my understanding that Brittany will be meeting with you this afternoon. So as soon as I'm done with my call, I'll be happy to get you connected up with Brittany so you can have the afternoon with her to see some of the prevention and wellness programming.
Thank you. Thanks again for your time.
Okay, Brittany, where are you taking me today?
Right. Today I am taking you to the Park School in Baltimore, and we are going to be meeting with Ashley Edwards.
JCS recognizes that in order to effectively address mental health in our community, we must put a focus on prevention. That is why they are in schools with programs that address bullying, depression, and addiction.
So right now with Park, we're doing programming on substance use and addiction. And it's cool because the way that we teach this program is through dramatic arts. We give students the opportunity to act out real life scenarios that we might have actually heard from people in recovery or people who have a loved one who's going through recovery. And we're planting seeds so when the student maybe comes across that in a future moment, they can think back, like, what did I learn, and maybe choose a better.
Yeah, I mean, it just sounds like having familiarity with the topic
Yeah.
or having acted out how one should respond, perhaps.
Yeah, and we get really candid.
Great muscle memory for your brain.
Yeah, and we
Right.
do get really candid. It makes it real for them, and then sometimes we bring in other speakers too to talk about, their recovery journey.
So we're here.
We're here.
And now I'm gonna get to see a little something in action, right?
Yes, you will.
On the way over, Brittany told me about the program. I'd love to hear from you how you brought the program here.
Yes, so wellness has been going on at the Park School of Baltimore since probably its inception. I just actually inherited it maybe about 2 years ago, and I wanted to kind of diversify the facilitators that we had coming in, primarily with Park being a Jewish population, and obviously wanting to start with Jewish Counseling Services. It just made sense. We wanted to allow the students to have more conversations in smaller spaces where, we as faculty, we as staff are removed from that space, and so they feel a little bit more comfortable, a little bit more safe to be able to have those conversations. And I definitely think that JCS allows that to happen in this space.
What are you proudest of about this program?
So I think, what am I most proudest of? One, probably diversifying our facilitator groups. I'm also proudest of just our students and how they connect and collaborate as a community, as a Park community, just being in the spaces with our external facilitators and, being appropriate and asking good questions and just kind of being engaged. And I think definitely with JCS being a partner that they actually allow that to happen in this space, and which is why we continue to collaborate. If we have some time, I'd love to show you my space, my classroom. I have a class in a
I
few
got
minutes,
all
but
the time I've got more time than you do, so take let's make it work. We'll make it work for sure. Thanks for joining me today. It was really enlightening to see all the hard work being done by the Associated's Jewish Community Services to address mental well-being in our community. Before we leave, I want you to know that if you or someone you love is experiencing a mental health challenge, please call JCS at 466-9200. And for more information on how the Associated system is addressing mental health, go to associated.org/mental health.